Welcome back to Get Pain Free TV, and congratulations for being proactive about your health and requesting your free video course to learn the 5 crucial steps to follow to become free from chronic pain now. Hello, I'm Michael Greenspan, Neuromuscular Therapist for 20 years now, and I'm here to show you the correct order to rehabilitate 99% of all chronic musculoskeletal pain conditions, such as back pain, neck pain, shoulder, headache, migraine pain, carpal tunnel syndrome, TMJ, hip, knee, or sciatica pain, foot or ankle pain, and more. And to show you why, if you don't follow this exact order, you really risk remaining in chronic pain, often getting worse. And I touch upon each step briefly here, so really make sure to check out the more in-depth and detailed videos or articles on the website, as I'm regularly adding more information to help you prevent and end your chronic pain. So let's get started here with step number 1, which is to eliminate the spasms and hyper-contractions or hyper-constrictions in your muscles. Most importantly, this means releasing the trigger points first, which are like landmine knots in your muscles, and they are at the source of 80% or more of chronic pain. These little X's represent the trigger points, and they radiate pain to where the red areas are. So if you get headaches above the eye, in your head, base of your skull or jaw, pain down the back or side of your leg, to your calf, to the outside of your foot, in your hip, they can come from the trigger point right here in your gluteus medius muscle in your hip or your lower back. Headaches often come from the trapezius muscle right here. Many muscles, every muscle actually radiates to a different area, and each muscle has a distinct, unique referral pattern of trigger points. Okay, so moving on to slide number 3, is that research proves that your trigger points, these little landmine knots in your muscles, actually weaken and they tighten your muscles, and they radiate or refer pain to other parts of your body. You see, the source is the trigger point, yet you often feel pain somewhere else. For example, in the photo here, the trigger points in the upper shoulders and neck are the root cause of the headaches. Or trigger points in your hip are the source of low back or sciatica leg and knee pain down here. These trigger points are pretty amazing, and they are like landmine knots inside your body. And they're not regular muscle knots. They actually speak and communicate with your brain and spinal cord and your nervous system. So they are much more than just a regular knot, and that's why I call them landmine knots. Now, one secret is that you really can't stretch out. Research proves that you cannot stretch out trigger points. What that means is that while stretching may feel good, you feel looser, which is great, ultimately you can't stretch out your chronic pain without releasing your trigger points first. This is a really big concept and very important to understand. Poor posture greatly aggravates and activates your trigger points. And this is why we often get trigger points. We get trigger points from muscle imbalances, which leads to poor posture, which leads to the muscles activating, which causes trigger points. So muscle imbalances and poor posture are the number one reason to greatly activate trigger points. And stress and repetitive movements do as well. It would be really helpful if you check out some of the more detailed videos on posture in the website, as I show you how to have really good posture sitting, what that means, what your blueprint is, at your computer, at your desk, sleeping and standing. And on a side note, while you can't stretch out trigger points and you need to release trigger points before stretching, it's very important to understand that you also must release trigger points before doing any kind of strength training, or you really risk more pain. Maybe you've done strength training exercises with little or no results, or even gotten worse. And it's usually because you need to release your trigger points first. So we always say lengthen before you strengthen. So you always want to get those knots and trigger points out, get the source of that pain out. Then you can stretch the muscle, and then you can start strengthening the area to stabilize it. Too often, therapists, trainers, or physiotherapists, or other practitioners will put you on a strength training program too soon, and that just continues the pain spasm cycle. It's important to understand then that no matter where your pain is, it's usually muscle imbalances leading to poor posture, causing your trigger points to activate, leading to chronic pain. So, do you want to know how to eliminate your trigger points and pain for good? Your options are using effective tools such as the pinky ball, the foam roller, the Theracane, your own hands, and you can release them manually and deactivate your trigger points and pain. Again, there's some great in-depth videos on the website showing you how to do this, and we sell these tools on the website as well. You can also seek out a qualified professional to treat your trigger points, like a neuromuscular therapist. Feel free to email me if you're in the Los Angeles area, as I'm happy to help you and see if I can help you, or refer you to one of the many therapists at my clinic that I've personally trained in neuromuscular therapy. And finally, since posture often causes trigger points, doing what's called effective postural alignment exercises to improve your muscle balance and engage your weaker postural muscles often gets rid of your trigger points for good. This is step number 2, which is highly effective exercises that brings your body back to its original blueprint of proper posture. So you have better muscle balance and neuromuscular re-education of your weaker postural muscles, which eliminates your trigger points and helps you to become pain-free. Check out the more in-depth videos in the website on what postural exercises really are and how they're different from your typical exercises that you may have done in the past. Okay, so why postural alignment exercises are so important to do next. Before you stretch and before you do strength training, you see, you must get straight before you get strong. Straighten before you strengthen. This concept is huge because if you go to the strength exercises too soon, you're building a stronger, more posturally distorted body. So first get straight and posturally aligned, and then do strengthening exercises to reinforce this and build a stronger, more posturally correct body. Postural exercises are so important to do before stretching as well because they reunite all parts of your body as a unit, because they engage and they neuromuscularly re-educate and reprogram your postural muscles. They work you from the inside out, and they give you a deeper, on a deeper level, and they give you more force, balance, and stability. So this is so much more important to do first in order to eliminate your chronic pain, even before you stretch any tight muscles. Okay, so the benefits of correct postural alignment and muscle balance is that when you have much better posture and you're posturally aligned, this gives you better organ, blood vessel, and nerve position. It dramatically affects you physically, psychologically, emotionally, and energetically when you are lined up more vertically like this red line here, where your head is over your shoulders, over your hips. And most importantly, physically, you have much less strain on your muscles, ligaments, and tendons that are fighting so hard to hold you upright. Your postural alignment and muscle balance blueprint looks like this. Okay? This is the blueprint we're trying to achieve. It's where your shoulders, hips, and your knees and ankles line up front and from the side. See, your shoulders are level, your hips are level, and you don't have any rotation in your pelvis or your torso from the front or from the side. Your ears over your shoulder, over your hips, over your knees, over your ankles. This is true muscle balance. This is not Java Man over here, third guy over on the evolution chart. And you want to work towards this alignment, not work towards Java Man. So let's go to the next slide here. And I want to show you something right here. These people are very sad. They're very much in pain. And this is what different types of poor posture and poor postural distortions and chronic pain looks like from the front and side view. The key that most medical professionals and practitioners fail to explain, treat, and prevent is that it's your muscle imbalances that causes any poor posture or postural distortions, which then causes trigger points and your chronic pain. You see, these unhappy figures show you when your posture doesn't line up, it causes many types of pain. These 4 lines and dots are supposed to line up, and they represent your shoulders, your hips, your knees, and your ankles. You see a high or low shoulder or a forward head posture like this, or a high or low shoulder can cause headaches, neck pain, shoulder pain, or arm pain. And notice how when your hips, knees, and ankles don't line up, it can cause lower back, hip, or knee pain. Lots of pain when you're not posturally aligned. So, in order to fix your specific muscle imbalances and postural distortions with the correct postural alignment exercises, your specific muscle imbalances must be determined first. Again, check out many of the videos on the site on determining your muscle imbalances and some exercises to fix them. Here's 4 common types of posture alignments. Notice how the red lines are different for each of them. Once your specific muscle imbalances and postural distortions are determined, only then can the correct postural exercises specific to your body be given. So postural alignment exercises are specific exercises that realign your posture to eliminate your pain. They fix your muscle imbalances. They're personalized to your body's unique misalignments and muscle imbalances, and they address your entire body as a unit versus traditional physical therapy exercises. Now that you've released your trigger points and neuromuscularly re-educated your weaker postural muscles with the correct posture alignment exercises, it's time to restore flexibility to your tighter muscles. So you lengthen them first before you strengthen them. Your tighter muscles stretch much better after your trigger points are released and the postural muscles engage better. Remember, you can't stretch out trigger points. You can't stretch out pain. That's why stretching is step number 3. So if your pelvis tilts forward like the diagram here, you have short, tight hip flexors and need to stretch them out more with stretches like the hip flexor or psoas stretch here. It's crucial to identify your short, tight muscles in order to know which ones to stretch. Go ahead and look at some of the other videos to learn how to properly identify your short, tight muscles and stretch them out. Now that you're much straighter and have much better muscle balance, it's time to strengthen the injured tissues. Here's where many traditional approaches fail because they give you strengthening exercises way too soon. So often, to break the cycle of chronic pain, you must get your trigger points released first and muscle balance and posture alignment fixed before doing strength training. So get straight and then strengthen, and you'll be much happier and freer from chronic pain. Check out the videos on the website that show you the proper strengthening exercises to prevent your chronic pain. Finally, step number 5 is to increase your muscular endurance with the correct functional endurance exercises and keep the correct posture alignment while you do this. By this point, you're already free from most of your chronic pain after following steps 1 through 4 properly. So, while steps 1 through 5 are crucial, key lifestyle modifications are very important as well for becoming pain-free. And since that's your goal, let's go over a few. To begin with, you must start correcting your postural alignment, sleeping, sitting, and standing. Definitely check out the other videos on how to sit, sleep, and stand properly. Learn how to breathe properly, diaphragmatically or belly breathing instead of type A chest breathing. And get better at managing your emotions. Often negative emotions really do continuously exacerbate the cycle, especially if you're constantly agitated and reacting. There's great meditations and techniques to learn to better manage your negative emotions so they don't manifest and go into your physical body, causing you more chronic pain. So in summary, learn how trigger points cause your pain and how to treat them. Know your muscle imbalances and do regular postural alignment exercises. Release and lengthen your tighter muscles. Strengthen your weaker ones. Learn what it means to have good posture sitting, sleeping, standing, and walking. Learn how to properly breathe. Belly breathing. Decrease inflammation in your tissues. Nutritionally, with a gluten-free diet, natural anti-inflammatories are great. Ice is helpful. Manage your emotions better and become conscious of the many levels that contribute to your chronic muscular pain, physically, mentally, emotionally, spiritually, and nutritionally, etc. It's my goal to have in-depth videos on all this information to help you live a much more pain-free life. So check the website regularly for more information. If you find any of this information or any other videos info helpful, please click the like button. It really helps me, and leave a comment as well. You can follow me on Facebook, Twitter, and the YouTube channel as well to receive regular information. And I truly hope you learned something here and I'm able to make a positive difference in the quality of your life. This is Michael Greenspan from Get Pain Free TV. Thanks again, and I look forward to helping you get pain free.